I know we've got a question from the audience community, but just want to squeeze one more in. I know your role as a pharmacist. Now, I may have this wrong, but in my mind, pharmacists are kind of like, in some ways, the canary in the coal mine. They know what the inflow, outflow is. Are there things that we should know about the pharmacists and what role they can play, or amping up their role in terms of alerts and what the flow and need is out there of various key pharmaceuticals?
Well, that's a great question, because pharmacists are the most accessible healthcare professionals in America. 95% of all Americans live within 5 miles of a pharmacist. And I've felt for a long time that we're not utilizing pharmacists in particular, but a number of healthcare professionals to the top of their license. And I've discussed this with Dr. Adams, with the Department of Public Health, with Secretary Azar, with HHS, Administrator Verma, and they all agree we need to be utilizing these pharmacists, not only in situations as you described where we see a shortage of different drugs and we can learn about it, but also as we're going through this COVID-19 pandemic, being able to test for this, being able to administer the vaccines. Most people are getting their vaccines from a pharmacy now, from a pharmacist, and we need to be able to administer the COVID-19 vaccine. That's going to help us to get it out to the people as quickly as possible and as safely as possible.
Well, thank you for that. We've been taking questions from the audience, and we have one now from Buddy. Buddy?
I'm Kevin Donnelly, CEO of TCPI in Chicago. What's the appetite of industry providers and the current and potential administration for the added costs and challenges of onshoring more of our pharmaceutical supply chain?
So, great question. Question is, are we willing to pay for it?
Well, that is a great question. And, I don't think the question is, are we willing to pay for it? We have to pay for it. We've got to be prepared for this. And I think that we all agree that this is necessary, and that in order to attract these companies back to America, we've got to be competitive. These are private companies, and the primary reason they went offshore in the first place was financial incentives, whether it be lower manufacturing costs, lower labor costs, or whatever it is. We in America, we're going to have to bite the bullet, and we're just going to have to step up to the plate and do what we have to do. I think we recognize that now.
Buddy, I know I follow you on Twitter, so I know that you are, right now, you've signed up for a vaccine trial, and you've said you're going to sign up, you believe we're going to come up with a safe and effective vaccine. And, I just want to wish you well in that. I hope it goes well, because I really like folks that stand up. It's an important time. So how's it going so far?
Well, so far it's going very well, and I did start and had my first dose, and in about 3 weeks I'll get my second dose. I don't know whether it's a placebo or the real thing. The doctor doesn't know. The staff doesn't know. None of it's a double-blind study. Only the number on the vial, whoever's got that key, will know whether it's a placebo or the vaccine. But I keep a diary, a daily diary of symptoms, of how I'm feeling that day, what my temperature is. Listen, I believe that it's important as a member of the healthcare profession, as a member of Congress, for me to put my money where my mouth is. And that's why I'm very confident that we're going to have a safe and effective vaccine, so confident that I'm willing to go through the process myself.
Well, if your blood pressure and temperature went up right now, you can blame in your journal Steve Clemens of the Hill. But Representative Buddy Carter, thank you so much for joining us. I know you've got a lot on your plate right now with the election just around the corner, so thanks for joining us.
Thank you.